Well, first of all, I feel a bit like the minister who has to give a sermon after a long day at church and everybody's got to go home and eat. So I will try to be brief and I'll try to be to the point. The other thing I wanted to say is the father of 5 22 to 26-year-olds, I want to tell you how much I appreciate these 2 days of training. It gives me a feeling that we may have a chance. It's just been, in fact, I was texting some of my children during this, been back and forth. They said, my daughter did say the one thing to mention is that good shoes are really important, but I'm not quite sure that that's what we're talking about here. So I'm going to try and talk about, I picked the word quandaries for real reasons because I think this is a really a deliberative study of what is it that we should study kind of situation. And there were two themes that I thought were going on that we should talk about. One was the health and well-being and what can we do about that? What's the state of the situation? What are the risks? What are the problems? And a little bit of where might there be some opportunities. And then there was another one, which is we don't know really enough about what we mean about young adults, what we mean by young adults, and young adults, particularly in the 21st century in this country, to have the scientific basis to start to talk about what we should do. And we really, the Larry Steinberg statement of we don't know a lot. And I think that those two pieces seem to keep cropping up all throughout the 2 days. So I'm going to try and give my take on what I think are some important points, and including some things that I think we missed that would be important to have considered as we move forward. Oops. Okay. So some notable characteristics that were brought up during the course of the conversations over and over again. First of all, that it's finding that there's continuing, but not simply linear brain development going on at this age. That's a very important finding. And to scratch that surface and to dig into that further. And if what's going on there is some reorganization of the pruning, some stepping back from the pruning to a little bit of, let's say, too much connection and then specialization, that is almost too nice a fit to what we think of as during this time. But that sounds very important. Secondly, that this is a time where we're talking about somewhere between a social and a psychological and a neurological consolidation and setting into place of life course trajectories and the vast importance of the heterogeneity of development during this time, both in timing in terms of potential opportunities and life course, but that there's really a shifting in the orderliness of these tasks at this time and the extent to which these life courses are set. I'll talk a little bit later, but one of the findings that's come out recently is that the average college graduate will have 4 careers, not 4 jobs, 4 careers, and is likely to have 20 to 30 employees. So the nature of work, for example, has changed drastically, has a number of other things. The heightened risk at this time, particularly for serious and dangerous things related to substance use. I think that's one of the takeaways from here. A concentration on substance use like we did on youth violence or that we did on motor safety and things like that at different points in time. That this is a clear, critical, immediate health crisis that we should be focusing on that's related to this group. And the second thing that didn't get talked about nearly as much as it should have was the suicides and accidents, not motorcycles. Accidents and suicides, that these are the number 1, 2, or 3, depends on how they're counting, causes of death during this time, and they have, and are particularly heightened risk during these times. And because those are also health issues that affect the people at this age, so they're health issues that they're going to be attuned to, as opposed to chronic diseases, which we know are starting to occur at this point and develop, and that we need to start health behaviors related to that. And so later we're going to talk about health. I'm going to quickly get to health behavior as a critical opportunity in this time. Another thing was that this wasn't talked about quite as much, but I think is there, and I heard this actually from the youth panels a fair amount, was this idea that there's something that happens around 25. It's an inflection point. That this idea of 20, we were talking about what ages to talk about, and people have argued 16 to 25 is really, and then 25 to 35 kind of thing, or something like that. But there's something about 25, and it may be, again, this coincidence of neurodevelopment, sociological expectation, and psychological work that goes on related to those two. But something about what is it that 25 seems like an inflection point. And then this other idea, which didn't get on there, but is clearly here, which is what people have called horizontally knowledge and information. So the information isn't passed down from the elders to the youngers, and the wisdom isn't necessarily, in fact, wisdom and information are become different terms. But the idea that there's information out there, it can be got from lots of people, and it's not something that some people possess and pass on. And that idea as being a part of their life space, that's for us 20th century people is a concept we're still learning about. So those are some key things I thought went across these. And I'm going to throw in here quickly, if I don't talk about something you think was the most critical thing, or I don't get to this, it's not because I didn't have time. This is not Europe in 7 days. This is, I once took somebody through the Louvre in 45 minutes. That's what this is. And then also, by the way, we live in a situation in which there seems to be this prizing of independence and of certainty that just strikes me as pathological. And I don't know, I would like to come up with a nicer term for it, but it strikes me as very odd and probably damaging that we have this emphasis on this as an important characteristic for people to get early in their life and get it done. And so, for example, please complete one or more of the following somewhere between 20 and 25. Your education, you get yourself a job, make sure it's the right one, or it's a good one that you can make lots of money at, but also have time for family and do good and also be creative. And you have financial independence, that you have a marriage or something pretty close to that, and you have children or some promise of that, so you don't leave your parents grandparentless, grandchildless. And also do this with very few mistakes, but don't do it too soon, because then you're too early. And do it for the rest of your life. So if you think about this, if somebody said, here's my proposition to you, I think most would say, I don't want to play. Thank you. I'm going to go do something else. So let's keep that in mind, that's the life space. And I think that was another piece that's really important. I think the youth panels were great for that. Let's start talking about the life space of the developing person. And part of my theme is going to be more about the young woman's comment about mental health. That was such a great way of phrasing it. This is about people managing their lives and trying to make sense of things and trying to make their life work. And mental illness, mental health is not an on or off task. It's not you got one thing wrong with you and therefore you're a problem. You've got a life you're trying to make work, and it has some fluidity to it. Then this bounces back to the science part of it and the thinking and the developmental theory or quandary. If you're a developmentalist, this is the sort of wrestle that you're having almost all your time in your research. That there's some idea that so there are some universals in development. There are laws. Otherwise, we shouldn't be trying to come up with scientific studies for these things. That we should be able to identify, and it should be very important. But then there are meaningful subgroups that have differences that occur, and if you ignore those differences, you're really overgeneralizing, and you're taking one norm and trying to apply to others and so. Well, actually, everybody's unique. And so how do you match these three ideas together? And that's what developmentalists are always trying to wrestle with. And I want to throw that back to you and say, please keep that very much in the forefront of your minds as you work on this at whatever level. That really, can I suggest a shift towards what are the basic developmental and contextual understanding as one of the tasks. In other words, that can we come up with a framework that has a developmental and development within context orientation to this time of life so that then we can start to understand the nature of problems, the nature of needs, the nature of risk and response. We spent a lot of time over the last couple of days cataloging the number of problems that afflict these kids. And I don't want to be, this isn't to negate those at all, but most kids, most young adults are relatively happy and they are doing relatively well and they're trying very hard. And in fact, most of those kids with one or more of those problems that we listed up here are still doing relatively well. And we have to get a hold of that, because otherwise what we're going to do is we're going to just pathologize them, and more importantly, we're going to miss what this young woman was so able to articulate, which is that this is about what they're trying to make happen. It isn't about what trouble they're running around blindly stumbling into. That there's a diversity of opportunities and support structures. That's what that's supposed to say. In other words, there is great differences in what youth have in this country, but internationally, and by social class in particular, and by other characteristics as to what are the opportunities they have and what are the support structures. So we can't come up with a single normative and then be either graciously or because we need to looking at some variations from that. We really got to think about 4 or 5 patterns or trajectories that are meaningful and can be seen as normative. But we're going to have to make a real clear distinction between normative and healthy. A lot of what's normative may not be healthy, and a lot of what may be healthy may not be so typical or normative, and to keep that in mind. This, again, some of the, Larry raised this up, and a couple other people talked about it too, and I thought was a very important point, which maybe we should be focusing more on the issues of self-regulation than we have as a critical life skill that goes on, and during this time there's some important work. A different way to talk about it, and I know this is some of the work, I mean, Ed's comments and some other people's comments touched on this very closely. It's this idea of responsibility. I think that's a way to think about it that's a little closer to the way I think of it from a positive youth development perspective and a cultural fit, is how does one become more responsible for your life and for your actions and for your situation. Meanwhile, this idea of connection being really important. It's not about getting autonomous and independent. It's about being connected in a different way, and maybe even more connected. The older I get, the more I seem to be connected in, at least the more I seem to be responsible for more and more people. And I need more and more people to help me. And then there's also an idea of identity, not to get rid of this idea of identity as being something that's not important, but to really take it seriously and think about it carefully about who are you and what are you here about and what are you supposed to be doing. That's really, if you ask these, a lot of times when people say, I don't know about what choices to make, that's what they're struggling with. And so how can we think about that as important? And that they're living in a changing world as we are, so that it's a moving target of as to what are the benchmarks against which we're going to be trying to look at these things. But that's the new normal, so to speak, is that the world is changing constantly, and that adaptation and change is going to be even more immediate and ever present. So here's some things I thought we missed a bit, and I hope that we can conclude as we move forward. First is really trying to articulate a sound, critically formulated framework. Let's take some time and energy to talk about this. This is really important. This is not just a nicety. It's not, and we can't say we don't have time to do it. The positive and the capability approach, even though we talked about problems for the last 2 days, let's talk about how do we help support and manage and help young adults support and manage their health. The changing nature of work, I talked briefly about that was really not touched on, and probably one of the biggest changes in most of our lives, and certainly is going to be for that generation versus our generation, the coming generation. This idea of the good life instead of the right life. By the good life, I mean what philosophers mean when they talk about the good life. What is a good life and how to do that? Versus the right life, which is really kind of a way that we've taken some of those things and distilled those into the map of the road you ought to be on. And if you're going to vary from that, you ought to have a really good reason, and you ought to be trying to figure out how to get back on that road. And how do we take that misunderstanding out of trying to be helpful and include this part of the population in the normal parts of life? And how do we talk to these folks about what is a good life and what's important, and why it's important to think about that? That transition rather than achievement of independence is what we're talking about. Transition and how we're related and how we're engaged. And one of these ideas is to think about these multiple longer cohort studies, because interdependence, financial and emotionally, and even in terms of living situation, is much, much more the norm in history and elsewhere than is this idea that if you have your own apartment and you're paying your own bills and we get to see you once a month, that's good. That means we've done our job. And then this issue of the social class differences sharpening. There's sharpening in the sense of the divide and the discrepancies in opportunity and resources that are related to social class. Rand Conger mentioned the idea of the decrease in ability to change social class across a generation or two. The differences in income between higher and lower. You can think of all these things. These are big changes, and probably in ways that haven't been here for 3-4 generations, and that's becoming a more critical part of life. And then there was this group called Frameworks that works out of Harvard, and what they do is they try and take messages about children's mental health and children's development and communicate it out. And we've worked with them on a couple of things, and here's the really important lesson. We have no idea how to talk to the public about these things we know a lot about. We say what we think are the messages that will be heard by the public, almost often A, aren't heard, and B, don't resonate with them. They don't touch on some values. And so what they talk about is this swamp that is between the message and the reception, and the swamp of beliefs and conjecture. And frankly, I'm a little worried that that's kind of where we are, that we might be in a swamp of beliefs and conjecture that are making it a little bit hard for us to get hold of what it is we need to do. So I want us to just consider that idea of whether we might need somebody to help us understand this better. The immediate opportunities that I see here, real quickly, because I know I'm out of time. The Affordable Care Act is the biggest experiment in inclusion of this group that's ever occurred. And it's an amazing opportunity, if we can, to think about how to pull out understanding of what this means, where they're going to, for the first time, not be the group that's least eligible to get insurance and get care. There's a large number of longitudinal studies, a number of them prevention trials, that have followed kids into the 20s and 30s, and there's longitudinal studies. These things can be reanalyzed with new lenses and new foci, and they can give us a lot of information quickly. The idea that healthy behavior is a critical responsibility and protocols for healthcare for young adults, these are just absent. But here's a time, so now they can go get healthcare. Now we can start to talk to them about driving wildly or drinking too much or unprotected sex when they come in for that, because that's what's going on in their lives. Heart disease and things like that, that's their vision stuff, that's not quite as critical. But now we could have a protocol where we could reach to them, be relevant to them, but also hit things that are critical to them. Models of places where health and welfare of young adults is going better. Why not see what we can do, both internationally and then within the US, where people are doing that. And then the use of media for self-management and connection and health, and the fact that it doesn't look like there's much of a divide around media access. There is some, but it's not nearly what we think it is. Access to the media may be one of the great democracies right now. I'm not going to talk about this. This is for that we need multiple studies, from cohort comparisons to age-graded understanding of of changes to longitudinal trajectories and intervention studies, so on. That we need these studies on this group, and we need to look at it because right now we're in that swamp of conjecture. And that all things said, I'm still going to believe that research is our best hope for policy, and that that's not just a self-employment statement. I really do think that's the best way to help that young man get to be that young man. And also, I still have some hopes that maybe we can get some influence if we bring some facts with us. So thank you.